All right, let's dive into osteoarthritis. Managing this is a real journey, you know? It's not about a single magic bullet. In this explainer, we're going to break down the entire clinical pathway, from the very first lifestyle adjustments all the way to the operating room. So let's get right into it. So here's our game plan. First, we'll nail down a solid definition of OA. Then we'll walk through conservative management, talk about our pharmacotherapy options, and then get into the surgical pathways. And of course, we'll wrap it all up with the key take-home messages that are going to be super useful for you in your clinical practice. You know, to treat something effectively, you have to know exactly what you're up against. So let's start with a really precise clinical definition of osteoarthritis. Okay, listen up, because the key words here, chronic, irreversible, and degenerative, are absolutely crucial. They basically shape our entire treatment philosophy. Irreversible tells us right away that our goal isn't a cure, right? It's all about managing symptoms and improving function. And because it's degenerative, meaning it gets worse over time, we have to use a staged treatment approach that can adapt as the disease progresses. So where do we start with a patient? Well, before we even think about writing a prescription or booking an OR, the absolute foundation of treatment is conservative, non-pharmacological care. This is step one. And this initial approach really rests on two main pillars. First up, we've got the patient-led lifestyle changes. This means things like modifying activity to stay active without just hammering the joint, and, this is a big one, weight reduction to decrease the mechanical stress. It's just physics. Second, you'll formal physiotherapy, which is essential for keeping that range of motion, building up the muscles that support the joint, and managing pain. These two steps, they are the cornerstone of managing OA. Of course, there are times when those conservative measures just aren't enough to control the symptoms. That's when we escalate to pharmacotherapy. So, let's break down the main drug classes we have in our toolkit. We've got several options to work with. You have your NSAIDs like diclofenac, which are great for targeting inflammation. For just straight-up symptomatic pain relief, we've got analgesics from paracetamol all the way to tramadol. Now, if you need a potent, localized anti-inflammatory balm for a single joint, you can go with an intra-articular steroid injection. And finally, you have the SYSADOAs. That's a mouthful, I know. It stands for Symptomatic, Slow-Acting Drugs for Osteoarthritis, things like glucosamine and hyaluronic acid. As the name tells you, their goal is more about gradual, long-term relief, not putting out an acute fire. All right, so what about patients whose disease just keeps progressing and it's refractory to everything we've tried? Now we enter the surgical realm. And it's so important to understand that not all surgery for OA is trying to accomplish the same thing. We can really split surgical interventions into two main camps. On one side, you have prophylactic procedures. The goal here is all about joint preservation, slowing down that degenerative process, maybe correcting some underlying biomechanical problems. Then, on the other side, you have the therapeutic procedures. These are the definitive end-stage solutions when you're dealing with severe pain and a major loss of function. So let's look a little closer at those prophylactic options. A synovectomy is where we go in and remove inflamed synovial tissue. A joint debridement, usually done arthroscopically, is kind of like a spring cleaning for the joint. You're getting rid of loose bodies or trimming a damaged meniscus. And then you have osteotomies. These are really powerful procedures where we actually cut and realign the bone itself to correct the joint's mechanical access. It's all about shifting the load off the damaged cartilage. Now, moving over to the therapeutic or definitive procedures. Now, while an osteotomy can sometimes be therapeutic, the big players here are arthrodesis, or joint fusion, which gives you stability and pain relief, but at the cost of motion, and arthroplasty, or joint replacement. This is the gold standard for end-stage OA. It's worth pointing out that resection arthroplasty is pretty much outdated for primary OA these days. It's more of a salvage procedure for something like septic arthritis. Whew, we have walked through that entire management pathway. So let's boil it all down and summarize the most important high-yield points to remember for your clinical practice. So the crucial points are these. First, always remember that OA is an irreversible degenerative disease. Second, our management is always staged. We start with conservative methods, lifestyle, physio, and then we escalate to a multi-pronged drug approach. And when surgery is on the table, we think in those two buckets: prophylactic, joint-preserving procedures versus the definitive therapeutic options. And for that end-stage disease, total joint replacement is still our gold standard. So, to wrap up, I want to leave you with this clinical scenario to think about. How would your management of a young, active patient differ from an elderly, sedentary patient, even if their x-rays look identical? Really think about the role of those prophylactic versus therapeutic interventions. Applying this framework is going to be absolutely key in your clinical decision-making. Thanks for watching, and I'll see you in the next explainer.